Hello all, and welcome to our plenary session. My name is Kate Cleary, and I'm the Director of Communications here at ADAPT Community Network. We are excited for you to be joining us this year for our plenary session and an honor to announce this year's panelists. I am joined by Edward Matthews, Chief Executive Officer at ADAPT Community Network, and he will be a panelist and a moderator for today's session. New York State Senator Brian Kavanagh, representing the 26th Senate District covering Lower Manhattan and Western Brooklyn. And he is also the chair of the Senate Committee on Housing, Construction, and Community Development. New York State Senator Gustavo Rivera, representing the 33rd Senate District covering the Northwest Bronx, and he is the chair of the Senate Health Committee. Assemblymember Karina Reyes, representing Assembly District 87, covering Parkchester and Castle Hill, and she is also a registered nurse who's been working the front lines supporting New Yorkers during COVID-19. Assemblymember Linda Rosenthal, representing the 67th Assembly District, which includes Upper West Side and parts of Hell's Kitchen in Manhattan. And she's also the chair of the Committee on Alcoholism and Drug Use. Thank you all so much for being here today and participating in our important discussion addressing the needs of people with disabilities and providing insight and guidance for the year ahead. As I mentioned, our CEO, Edward Matthews, will be the moderator, facilitating the discussion and highlighting current events and challenges that we are facing in the disability community. Since this year we are facilitating it virtually, we gathered some questions frequently asked by people supported and family members, which we'll get into shortly. We do want to give the opportunity for our panelists to introduce themselves and give an opening statement. Can we start with Senator Brian Kavanagh?
Yes, it's great to be here. And I'll keep this very brief, but just first of all, let me thank ADAPT and Edward Matthews and Catherine Cleary for convening all of us today, and I'm looking forward to a great discussion. We have a couple of my terrific colleagues from Albany also joining, we've been working very hard, all of us in our various spheres, to address the very serious challenges that have come with the COVID-19 crisis. Obviously, it's a public health crisis, but also an economic crisis and a housing crisis, and really something that challenges all of our systems and has laid bare some of the kind of deficiencies in the way we do things in normal times. And obviously these are extreme circumstances. So we know a lot of people have been through a lot. We're working to address that. And, I look forward to a great conversation today.
Okay, thank you. Senator Gustavo Rivera.
Good afternoon or good morning or whenever it is that you're going to see it. Gustavo Rivera again, State Senator for the 33rd District in the Northwest Bronx, Chair of the Health Committee, and actually neighbor to ADAPT. Although we don't go to the offices that often, right? But my district office is at 2432 Grand Concourse, and ADAPT has 2 floors there. So we have been, my office has had a great relationship with the organization for a few years. And I am very glad to be here, glad to answer any and all of your questions. And if you are a resident of the Northwest Bronx, remember that if you know where the ADAPT offices are on 2432 Grand Concourse, so 187th in the Concourse, on the 5th floor is my office. So if you are in the Bronx, we work for you. So although we're doing virtual hours now, that is where my office is. So hopefully I'll get to see and meet some of you at some point. Thank you so much for having me here.
Thank you. And Assemblymember Karina Reyes.
Hi, everyone. Thank you. I want to thank ADAPT, Edward, and Catherine again for convening us, and my colleagues in government for helping have this very important conversation. I represent the 87th Assembly District here in the Bronx. I'm an RN and a mom of 2 boys, and ADAPT has dealt with a lot of the issues that not just my constituents face, but that I have lived in my professional career. And I have a lot of respect for the work that they do, particularly now when they are really striving to meet the gaps that have been laid out by the current pandemic. And I think it's our responsibility not just to have these conversations, but to figure out solutions for the population that ADAPT serves. So thank you again for this conversation.
So I'm Assemblymember Linda B. Rosenthal. I represent the 67th Assembly District, as you said, Upper West Side, parts of Hell's Kitchen. I've been in the Assembly 14 years, and I'm chair of the Committee on Alcoholism and Drug Abuse. I like to pass legislation, so I've passed more than 120 laws so far, and they range from bills in the alcoholism and drug abuse sphere to housing, on domestic violence, on animal cruelty, environmental issues, and everything in between. I'm happy to be here with you discussing ADAPT Community Network today. And I know that with the COVID-19 pandemic, people who already have challenges in life are facing even more. So it's a very important discussion, and thank you for convening it and inviting me.
Thank you. And I will give it over to Edward Matthews, our CEO.
Thanks, Kate. And I'd like to thank all of the esteemed members of our state legislature who have joined us here this morning. And there are about 400 people registered for this conference, so that hopefully we'll be able to address some of the issues that that you're most concerned about, as well as, and Kate will tell you later how to get some of your questions in later on that we will all be able to answer for you. So with that, I wanted to thank all the members of all of you for registering and being here with us today. It's my privilege to have been the CEO here for the past 31 years. And I also spent time in state government. And so, as you know, we have a lot of challenges, and parents and family members of both children and adults have been affected disproportionately, I think, by the pandemic, as well as some of our other folks out there in terms of housing and education and certainly healthcare. As you know, ADAPT has done a lot of work in housing. We do a lot of housing assistance, and we do renovations for apartments, not only in NYCHA housing, but for people, so that folks can stay in their home and find easier ways to get in and out of their apartments and homes. And we thank Senator Kavanaugh for his leadership in housing. Our office, our main office at 80 Maiden Lane, is in the district there, so we touch everybody here. So, Senator, obviously one of the things that families are most concerned about is what resources are available for folks in looking for low-income housing or affordable housing around the city and around the state.
It's a great question, and one we get from many people very frequently, and I think all of our offices, and it is a challenge. The programs that are sort of formally subsidized by federal, state, and city resources are typically run by the city. So HPD, the City Housing Preservation Development Department, is the principal kind of organizer of that information around new developments that are coming on. They run lotteries for housing developments that one can sign up for. And they also have various resources to assist people in looking for housing, in advice about how to how to identify potential places where you could live. Having said that, it is very challenging. We have a very, very tight housing market. One of the things we did last year was pass laws, the Housing Stability and Tenant Protection Act, which is intended to prevent the deregulation of thousands and thousands of units that had been deregulated over many years, and was reducing the supply of affordable housing each year. So we're hoping that going forward, as we develop new affordable housing, the overall stock of affordable housing will increase, because in past years, as we built new housing, it was any gains were offset by the losses of affordable housing in the rent stabilization program. You also should, each of you have an assembly member and 2 senators on here, but each of you has local elected officials, and you should reach out to them directly, to their offices. They may know of developments that are coming on. We do get notices of things that are happening, and you can reach out to them as well directly. If you go to Who Represents Me NYC, If you just Google that, you'll get a thing that'll tell you all of your city and state and federal reps, and it's worth reaching out to their offices and asking that question locally as well. But it is, again, I also would, we probably get into this in a little bit, but I also would note that there are specific rights that people with disabilities have with respect to housing that may, that you should be aware of as you're looking. But I think I'll turn back to, if you want to.
No, I think, Senator, I think that's one of the questions that we get frequently from family members, and our information and our resource lines is what rights do tenants in both in publicly assisted housing have? And you just mentioned a new law that passed, the Tenant Protection Act, as well as some of the other things you touched on. Maybe you could talk a little bit about that.
Yeah, so under federal, state, and city law, it is illegal to discriminate against people in housing based on a disability or a perceived disability. That includes in rental housing. It also includes in home, in home ownership. We have been in recent months doing hearings on Long Island in response to Newsday. The newspaper did a great piece that it focused mostly on racial and ethnic discrimination. But what became clear is that there's a lot of discrimination going on, a lot of behavior that seems explicitly illegal. And so we are now working we're working on a package of legislation to strengthen the ability of government to respond to discrimination that's going on, including working with the Attorney General's office. But if you believe you're experiencing discrimination, the Attorney General is one option, the State Attorney General, Tish James, but the city and the state divisions of human rights also will enforce the housing laws. And again, it is absolutely illegal to be discriminated against based on a disability. You also have a right to request an accommodation. An accommodation can be something that the landlord changes their policies, the way they operate the building. They can, for example, request that rent bills get sent to a third party if there's somebody that helps you keep your bills current. You could also request physical modifications to your apartment. Unfortunately, under current law, the landlord does not necessarily have an obligation to pay for physical changes to the apartment. They can make the case that it's too expensive for them, and that's a sort of a decision that's made case by case. But as Matthew noticed up front, there are organizations, including ADAPT, that will assist people in adding, various accommodations and making changes to apartments to help accommodate you. I mean, I just realized I think I just called you Matthew and I meant Edward. Sorry.
That's quite all right.
As Mr. Matthews mentioned up front. So you do have rights. And again, I also would say that we have had situations where we have advocated directly for our constituents when a landlord is saying that they can't accommodate somebody. We will push hard for that to happen as well.
Yes, I'm glad you mentioned that, Senator, because as I mentioned early on, we do get we've been fortunate in some of our programs to have grants from both the New York State Division of Housing and Community Renewal, as well as the New York State Health Department, Senator Rivera, on their nursing home diversion program, that we've been able to access funds virtually every year for, of course, it is income dependent, but for folks who in both public housing and supported housing, and even who live privately, who meet the income requirements, to be able to do modifications. And landlords have been generally pretty good about that. Certainly the city and any of the other public housing has been very good about it, so that we can widen doorways, bathrooms, do accessibility, widen doorways in bedrooms, and allow for wheelchairs and better access to the apartments. And in some cases, we've been able to put ramps and everything on some of the housing, so that people can access the community as well. So we thank you for your leadership on all of that. I do have another question. The ADAPT and some other agencies in the city have worked somewhat successfully and unsuccessfully with some of the developers who do supported housing here in the city of New York and throughout the state. And one of the things that I am sad to tell you is that although there have been set-asides for people who, for some groups, the way that the New York State Office of People with Developmental Disabilities has allocated money, there has never been a successful supported housing program with a set aside for people with developmental disabilities done in the city of New York. It seems strange to them. It surprises them that the cost of doing housing development in New York City exceeds the cost of doing the housing development in Utica. So they try to make those allocations based on some of the upstate costs. So I guess it's not a question, but an encouragement for you as the chair and your committee to work with OPWDD in the coming years to help them find ways to make better accommodations for us to work with developers in the city who've been very willing, but
Right.
we've been unable to match some of the costs that we're able to do in other areas of the state. So as you know, as group homes and things like that, and the capital for those are going to dry up, I think the supported housing is one of the ways in which families and people are going to find housing and independent housing in the future. So I'm encouraging the committee to work with us and OPW to make better allocations for set-asides for people with developmental disabilities.
Good. Yeah, no, and let me just to respond, I would say that, this is a good moment to be having the conversation because we are coming to the end of the governor's previous 5-year plan for affordable housing, including supportive housing. And we are going to be having negotiations about what the next 5 years look like. And we've been pushing for greater funding for supportive housing to accelerate the rate at which the state produces affordable supportive housing units. So we should have this conversation about whether the formulas, the cost formulas and limitations need to be adjusted to reflect the higher costs of the city, because everybody knows that costs here are much higher in virtually every aspect. If I could mention one other thing before we go on, I probably should have mentioned this up front, but one other resource that people should be aware of if you're a renter is the DRE program and the SCRE program. These are programs that will freeze your rent if you're rent stabilized, or in certain other developments where the increases in rents are limited, like some of the, they're very. If you were a renter, you should be looking into whether you qualify for the disabled rent increase exemption program, and or the senior citizen rent increase exemption program. In each of those programs, we raised the income limits a few years ago so that you can be making currently up to $50,000 household income. There are currently the head of household needs to be either 62 years old for SCRE or experiencing a disability for DRE. But these are programs that will freeze your rent indefinitely where it is, and the landlord is compensated through a property tax break. They're somewhat popular programs, but we know that many people who qualify have not applied for them. Similarly, if you're a homeowner and you have a relatively low income, you can get property tax exemptions through a companion program called the Disabled Homeowner Exemption. So that's sometimes called D, but you should look into those and see if you are eligible, and certainly apply if you are.
And of course, the governor has extended, I think, some of the freezing of rents and the forgiveness of rent payments during the pandemic up till, I forget now what his latest date is on the emergency, but people should still be able to take advantage of that as well, especially those who have lost their job through this period.
Yeah, we've worked very hard to make sure that there is an eviction moratorium in place. There's been a complete moratorium in place since the middle of March, which my colleagues and I, including my colleagues on the phone today, pushed very hard to get. And the current situation has gotten a little complicated. The governor has issued an order that's extended through December 31st. We're still waiting to see whether the courts are going to interpret it as a complete moratorium on evictions. But at this point, if you're experiencing a financial hardship, it is clear you cannot be evicted anywhere in New York State through the end of this year. And again, that's something we've extended periodically. We've also been looking to do that, to do something even stronger legislatively. And Karina Reyes, who's on the call, is one of the great leaders in the Assembly on that issue. There's a couple of bills that I sponsor, that I've been supporting and trying to push along with my colleagues in the Assembly to extend that. It should be noted that if you can't, it is not a rent holiday. So if you can pay rent, you still have an obligation to pay your rent. And there may be consequences if you don't. So if you can pay your rent, you should continue to do so. But if you can't and you're suffering a hardship and you can't pay you're having difficulty, you should contact your landlord and tell them that. And at present, you can't be evicted for that reason.
Thank you very much, Senator Kavanaugh. It's very helpful. And as I said, folks who are listening to this panel discussion will send in some other questions. So Kate will probably be back to you shortly for some clarification, as people have some questions that some of this conversation and this discussion have spurred them for. So thanks very much.
My pleasure.
And,
great.
Senator Rivera, who is our chair of our health committee in the Senate. The biggest question I think that folks have is all about Medicaid and Medicaid eligibility. So rather than be specific, I'll just throw that whole issue to you and find out, how people get eligible and what your office can do to help. It's a tiny general
issue. Before we do that, I actually would want to give an opportunity to Assemblymember Reyes, since she is the sponsor of that bill on the housing bill over in the Assembly. I did want to give her an opportunity that she can talk a little bit about the bill and the work she's doing over there, because Brian is right. She's definitely been one of the big leaders over there. And I just wanted to give her an opportunity before we move on to Medicaid, if we can.
Very fair. Assemblymember Reyes.
Sure. So at first, I want to thank Senator Kavanaugh for mentioning our legislation. So there have been numerous measures put in place by the governor via executive order to create a moratorium, but it's not really truly a moratorium. What it is an affirmative defense in court that somebody has been unable to pay rent because of COVID-related reasons, and therefore not be able to not start an eviction proceeding. But currently, the housing courts are open, and the landlord can still place a money judgment on unpaid rent, which can potentially mean that you're not evicted now, but when the moratorium is lifted, you could potentially start eviction proceedings. And that could be as early as next month. And we know that we are still currently in the middle of a pandemic and a crisis. So I introduced a piece of legislation along with Senator Myrie in the Senate that would create a blanketed eviction moratorium for a year after the state of emergency is lifted. That would be extended as well to commercial tenants, individual tenants, and it's also an eviction on a moratorium on foreclosures. And we believe this would be a true eviction moratorium, because currently, if you are unable to use that affirmative defense, a lot of tenants, particularly in upstate regions, don't have a right to counsel. So they don't have the ability to use that affirmative defense in housing court. It's easier for New York City residents to take advantage of that because there is right to counsel in the city in housing court. So we want to make sure that everybody throughout the state is really covered, and that we're not evicting people in the middle of a pandemic where having a place to live and having a place to quarantine is paramount in helping stop the spread of COVID-19.
I wanted to make sure
Thank you.
There was that.
Yeah,
I know that you're the moderator. I know that you're the moderator. I respect the moderator.
No. I want you guys to. I think the value of this is to have a free and open discussion. So please do.
Yeah, and I'm going to talk over Gustavo now, just to because I've learned that from presidential debates. But no, just to say that just for clarity, there are two pieces of legislation, and I Senator Reyes is the sponsor of one of them with Senator Myrie, and I have a bill also. I support both of them, and I 100% agree. We need the legislature to step up and make sure there is a moratorium in place as long as is necessary to prevent people from getting evicted as a result of the COVID-19 crisis.
We gotta, in these dark times, we do our best to keep it light while providing good, solid information, like my two colleagues did. And as a parenthesis on the housing issue, it has been consistently an issue. The biggest issue in my constituency, basically for the entire time that I've been in the Senate. And so this is people were in crisis before the crisis. So I'm very, I joined my two colleagues, and I'm fighting along with them to make sure that we can make this into a reality so we protect people. It was very good to do it last year when it related to extending the laws, protecting tenants. We did a hell of a job last year in being able to do that. And we need to do work this year to protect people who find themselves in weird situations because of the Rona. Now, you asked about Medicaid.
I'm feeling like Chris Wallace here.
Again, I respect the moderator.
Anyway, New York is one of the states, fortunately, that under the Affordable Care Act has expanded Medicaid for folks. But still, there's a lot of confusion, Senator, about how you qualify for Medicaid, where you can go, and how both families, there are families with deemed income and not deemed income, and certain waivers for that. So, I mean, just generally speaking, what's the best way for people to start to find out the best way for eligibility and how they can qualify? And then I'll have a after that after you talk about that a bit.
So the best way to determine that eligibility, I would say one of the things that you can do is you can certainly work through the offices of your local representatives. We work along with, as well as identifying the federally qualified health centers or FQHCs in your neighborhood. I mean, I'll talk, for example, in the Northwest Bronx, whether it's Union Community Health Center or Morris Heights Health Center, both of those folks are open to community members coming in and asking these questions. During these times, you'll definitely get like I went to my dentist appointment the other day at Union Community Health Center, and they have like a little monitor so that it's a TV, it's like a little screen, and you put your face on it, and then it measures your temperature. So you definitely will have to do that. But that is the best way to actually talk to someone that can actually ask you all the questions that are necessary to determine about your eligibility. Because in the state of New York, we have the Essential Plan, which is something that we expanded Medicaid in the state of New York a few years ago, which means that you have, it costs much less than other health plans, offers the same essential benefits. You can enroll online, actually, but going to an office, I know that, or talking to somebody on the phone who's knowledgeable about this, I know is usually the best way. So either reach out to your local elected's office. If you are in the Northwest Bronx, certainly reach out to me. And we have many of our, most of our colleagues, I will not speak for all of them, but most of our colleagues certainly will have the information that you need to be able to be eligible, to determine eligibility. And your local FQHCs, federally qualified health centers, would certainly be able to help you fully to determine your eligibility.
Assemblymember Reyes, you're a health professional. Is there anything you'd like to weigh in on just talking about that through your office as well?
I second what Gustavo said. I was going to interrupt on another housing issue earlier, but I restrained myself. But Medicaid has been something that is proven to be a true safety net for so many people. And we also have to be mindful that during the pandemic, a lot of our H&H facilities and public health facilities have really taken a hit because they have been serving people who otherwise would not be interacting with the healthcare system. But because of the current health crisis, they've seen an increase in services. And I think it's important that as a state, we continue to do everything we can to make sure that they are well funded, because they are truly the safety net for our city and our state.
Thank you. One of the for a lot of our folks, they're in that no man's land where, they're not eligible for Medicaid and yet do not have health insurance through employer or other things. And so I guess as long as we have it, what the advantages that the Affordable Care Act or other options that they may have to pursue and to try to get health care for themselves and their children, even though they may not be right now qualified for Medicaid.
One quick thing that I'll say about this is that there's a piece of legislation that I've introduced that would actually expand the Essential Plan, particularly during the crisis, during the pandemic, extending the Essential Plan for undocumented people, since there are undocumented folks that because they are undocumented, they have certainly access to emergency care, but they don't have access to primary care. They don't have an insurance product. So we did that. And there's another bill, which is the gold standard, which we are fighting for. And I know that we're going to talk about advocacy. So I would actually encourage everyone who cares about making sure that everyone has access to healthcare, not just access to healthcare, but that has guaranteed healthcare. In the state of New York, there's a bill called the New York Health Act, which actually would create a single payer system in the state of New York. And a simple way to think about it is guaranteed healthcare for every New Yorker. And we could talk about, we could go into it more deeply, but the bottom line is that there's many of us that recognize that there even in a state like New York that did expand Medicaid, that has an essential plan. There's other states in which such things don't exist, and in which the majority of people have some type of insurance. That does not guarantee you care, and we need to do better. And for folks who are developmentally disabled, or for folks who are undocumented, folks who are on the margins and vulnerable, we need to do more to make sure that there's access to care and that they have guaranteed access to it. So we're working on that as well.
The New York State Health Act, which is you said a single payer system, I guess that's to sort of smooth out the inequities between the Medicaid, Medicare, and private insurance payments that go. So tell us a little bit more about where that is and what we could do to find out more about that, and try to do some advocacy, because there are other people looking for an all-payer system, which comes down to about the same thing. But tell us a little bit, for all of you, what that would mean and how we could do some advocacy around that.
Well, thank you for giving me the opportunity to do that. Now, again, so the New York Health Act is a piece of legislation that would guarantee care for every single New Yorker. And that means regardless of age, gender, or immigration status, or wealth. And it would indeed equalize the system. And you might ask yourself, like, how would it actually work? Now, it's called a single payer system because right now we have a multi-payer system. What that means is that when you go to your doctor, the payment that doctor gets could come from a whole bunch of different places. It could come from private insurance, it could come from your pocket, it could come from Medicare, it could come from Medicaid, et cetera. But a single payer system means that the state of New York would be the one paying the bills. It does not impact, outside of making sure that you have access to the provider that you choose. It doesn't impact the decisions that are made between you and your doctor. Unlike now, when you have insurance companies whose job it is not to guarantee you care, but to guarantee themselves a profit. So we want to move away from that. And this bill, it has 31 sponsors in the state Senate. That is almost the majority of the state Senate. We have a body of 62. So we would need one more to have a majority in the Senate. We are still working on tweaking the bill to make sure that we can address concerns and legitimate concerns that have been brought up about how the bill is organized, how it would work. But I think that what this crisis has demonstrated is so clearly that the systems that are meant to protect us do not protect us. The lack of access to preventive care, just to pick one thing out of the hat, since there's a lot of folks who don't have access to primary care, who don't actually go and take care of a situation like a chronic disease in a regular basis because they don't have the ability to, because their insurance doesn't cover it, or because this person is out of network, et cetera. By smoothing that out, as you said, Ed, Mr. Matthews, I was just going to call you Ed, and I'm like,
Ed's fine.
I know the dude, but I don't know you that well. I don't know if Ed is permissible, but so smoothing out the system means actually securing primary care for everyone, providing preventative care for everybody. And if you have someone who had chronic conditions that identifies earlier, that means that you can actually manage that condition and you both feel better, have better health, and cost the system less. So and so this is one of the many things that we want to do with this. And the way that you can actually get involved, if you go if you Google New York Health Act, so just New York Health Act, you will be able to go to a website called Campaign for New York Health. There you will find all the information about how the bill is organized. You can read the bill if you want to read the technical aspects of it, but read studies that have been made to show you how it actually saves us money. And you can actually find all the information in one place. So if you Google campaign for New York Health, you can add yourself. And by the way, one of the important things that we know is going to get us over the hump of being able to pass this bill are the stories of people all over the state. Even people who are insured, I am sure, have many stories that show the inefficiencies of the current system, or the messed upness, to not use harsher language, of the current system. And those stories, you can actually share them with us, and we can then tell them to other people and say, like, do you really want to defend a system in which these are the things that happen? We can do better, we must do better, and I believe that with the New York Health Act we can.
And the reason that I wanted to ask all of you is that, you know, for children and adults with developmental disabilities, we've done so much in terms of finding equality, yet at the same time, so many of our folks still have so much difficulty accessing, you know, good healthcare. I mean, you know, we have more and more dual eligibles now who have Medicare as also their primary healthcare coverage, and that gets you better access than Medicaid does. But at the same time, it's still a major problem for folks. And as you pointed out, Senator, the FQHCs, the Federally Qualified Health Centers, have done a marvelous job in providing comprehensive health care for people. And, you know, they still have, there are more and more of them now throughout the city and throughout the state that we've been able to find. But Assemblymember Reyes, you're also a health professional. So I think one of the things I'd like to ask you to do is just talk about some of the things that your office has been trying to do to help people get better health care in your district and throughout some of the committee work you've done.
Sure. So first I want to say I have to thank Senator Rivera for his advocacy with the New York Health Act. One of the things that actually got me involved in politics was my advocacy work around the New York Health Act as an RN. And it's not just a compassionate thing for us to do to ensure that everybody in our state is covered, but it just makes financial sense. Because if you think about it, there is so much overhead in these multi-billion-dollar insurance companies. They have to pay senior management, they have to pay CEOs. These are millions and millions of dollars that are taken off the top of our healthcare system that could really go into addressing the needs of the people, and are being used to line the pockets of CEOs and upper management and countless insurance companies, because we don't just have one or two, we have dozens and dozens of insurance companies in New York State that are being used to manage federal dollars and state dollars for health insurance. But, you know, some of the things that we've been doing in my office and legislatively is supporting the work of our health chairs and trying to find ways to extend some of our social services and dollars. One of the things that we look to do was extend SNAP benefits during this time, which we know is the safety net beneath the safety net for many people who are struggling during this time. And it would allow individuals to use their SNAP benefits to buy hot meals, because many individuals who are either seniors or disabled, unfortunately, are unable to prepare their own meals, which means that they are subjected to either eating things that are frozen or super preserved, all these things that affect health because they are preserved with either high sugar or high salt, and creates this catalyst snowball effect in their health outcomes. So we've been looking at ways to address those little issues that we know have overall health outcome effects on individuals' health outcomes. And that's one of the things we've been doing legislatively and pushing legislatively. Another thing that we were doing in regards, I'm going back to this housing thing, was the Senator Kavanaugh mentioned for SCREE and DREE, how there are something over 50% of the people who qualify for it don't apply for it. And one thing that we did was introduce legislation to create automatic enrollment into SCREE and DREE programs for people who qualify. So they don't have to go to their legislators or look for a program that can help freeze their rent if they need it.
And for members of the audience, our own Project Connect will have more information about that as we roll out here as well. So that we're not done with Medicaid and long-term care yet. But I'm going to come back to that because it's the 800-pound gorilla here for all of us providers and families and individuals who receive services through the New York State Office of People with Developmental Disabilities. We're going to come back to that. Assemblymember Rosenthal, let me turn to you. As you said, you're the chair of the Committee on Alcoholism and Drug Abuse. And in our audience today, as I've mentioned, there are over 400 folks, parents, family members, care coordinators, service coordinators, and providers providing services primarily to those New Yorkers with developmental disabilities. But over the past decade or so, we have found more and more folks who, with these challenges still come with other issues such as alcoholism and substance abuse. And I'd like to turn to you and talk to about what parents who with kids and adults who are not yet in the system where we know them and have other services, who they might turn to find supports for their children, for themselves, or even some of the people in their own family that are not developmentally disabled who are facing some challenges, as you said, especially now when people are so isolated.
Right. Well, that is a great challenge. And as parents and family members already know that they are their own best advocates. And they're the ones who are the most aggressive, but it's because they have to be. And the system is not set up to be easy to navigate. So that's one of the first things I learned when I took this office is that the ones out there advocating do it because not enough attention and resources are devoted to their particular area of interest. So in schools, for example, I know that, there are many challenges that students face, and schools need to be working better with families to support people with needs. For example, people with IEPs, et cetera, had trouble accessing the iPads that were given out to every student across the city. And so that was a problem. Many did not receive those. So parents and others had to advocate, and electeds like me had to also advocate for them, say you can't leave kids behind just because it's harder maybe to reach them or engage with them, and to provide the services they need, even though remotely it's extra hard. There are state agencies that support children's behavioral health, like the Office of Mental Health, the Department of Health, OPWDD, OCFS. They all work in tandem, and families can contact those agencies, or on their websites it should be there are links to various services, but I find it best to pick up the phone and try to reach people in person. But there are a panoply of services. You just have to look hard to find them. And I think always relying on some of the groups and agencies such as ADAPT to actually, you've already all been through it. You have the resources that you can recommend. So that's another thing that can happen. But people certainly should call their electeds and ask them to help navigate the system.
Thank you. Yes, I'll put in a plug for us. Yes, we have our Project Connect, which does do just that, connect people with services, even if they're not our own, but try to get people the resources throughout the city that they have. So thank you for that. And
Sure.
Thank you for all your good work on behalf of so many families. Assemblymember Reyes, as a member of the Education Committee, right now, we have as disconnected a system as we could possibly find due to the pandemic. Just more and more now, school districts are throughout the state are closing. Individual schools are closing, and one of the things that we're finding is that where people can get assistance getting the tools and supplies that they need to have remote learning. For many of our folks, they have limited access to the kinds of tablets, and I know every education provider is trying to help but it's been very difficult for them through the New York City DOE, particularly, to access the necessary supplies to be able to handle remote learning. So I'm wondering if you could sort of comment on that and things that places they might go and how they might get some of these things.
Sure. So first I have to say, remote learning has been a challenge. It's a challenge for children that don't have and don't struggle with disabilities. And it's a struggle for parents as well. I'm a mom of two boys who are right now in the process of remote learning, and it has been extremely difficult. So the New York City Department of Education and the individual schools are responsible for ensuring that every child has at least a device needed to participate in remote learning. And the New York City DOE did put out a survey that they encouraged every parent to fill out so they can keep track of how many devices they needed to purchase. And we did see early on in March, when schools initially closed, that there were students who didn't have the necessary technology to participate in remote learning. They have been saying that has gotten better because they had the summer to make sure that they ordered enough equipment. So according to the information from the Department of Education, every child has been issued some kind of device. The tablets that come from the DOE are LTE enabled, which means that they have some kind of wireless connectivity where they can access the internet. For those individuals that are having trouble with Wi-Fi, I know that Optimum, Charter, Spectrum, Verizon all have some sort of low-cost Wi-Fi. Most of them require you to be a New York City resident, and if you participate in the free school lunch program, that automatically enables you to receive this reduced rate. Or if you are a recipient of SSI benefits, you're able to receive these reduced rates from a lot of internet providers to be able to access Wi-Fi, because that has been one of the biggest challenges, is having the device and not being able to connect.
Well, thank you. Assemblymember Rosenthal, let me turn to you. I wanted to know if there's anything else you'd like our families and people to know about the things that your office can do, and how you, and especially for those who live in the district, and the things that you get, some legislation you're currently working on, hopefully that would benefit families and people with substance abuse, mental health problems, or anything else.
Well, I as I said in the beginning, I try to work on lots of broad based issues, but some legislation I'm working on, which I think is pertinent to anyone with any medical issues, is telehealth. And so during the special session, I passed a law that would allow audio only to be reimbursed for telehealth, because it was only video. And many people don't have access to computers or smartphones or phones. And, you know, we need to do smartphones. We need to allow audio as well. And
especially for mental health counseling and abuse counseling and so forth. That's all of that. You can see all the members out there, they'd be smiling right now. That's a very good point.
Good. Yeah, that's very important. And I have another bill that would, you know, doctors are some shy about embracing telehealth for fear that they will not be reimbursed properly. And their time is their time. So half an hour in the office or half an hour on the computer or on the phone, maybe it's the same thing to them in terms of billing. So trying to create an equitable system for telehealth. And the fact is that, you know, we were moving in that direction increasingly, but COVID-19, which kept us all inside, has just, you know, it sped up that process. So I think we have to deal with rules and regs and reimbursements and all those policies now rather than down the road. And I know that,
especially now, since the Medicare exemption for all of that, at least through the crisis, has been extended by the Trump administration now, at least through to March of 21. But I do think this needs to be a permanent part of our service delivery for sure.
Absolutely. And you know, I have bills about you know, making medication assisted treatment easier for people to access. So someone who has alcohol or drug issues and says, okay, I'm ready now, I need buprenorphine. It shouldn't be that hard to access it. It should be like on demand, and we need more doctors with waivers to be present across the state. And we need it available readily. Also, the initiation into buprenorphine, the feds gave a waiver that you don't have to be in a doctor's office. You can be elsewhere to start it. So that's another important thing I'm pushing for. Also, unfortunately, on the drug use area, the Department of Health has to put out quarterly reports that reveal the numbers of overdose, et cetera. And the State Department of Health has not updated the numbers this entire year for this year. How can you diagnose and treat a problem if you don't know where it is? And I'm quite angry about it. And that's I understand everybody's involved with COVID, but COVID has.
Well, they weren't that great with that either. I mean, we had to really form our own coalition to put our own COVID numbers together. And the State Department of Health and OPWDD were asking us for our numbers so that they could update their own statistics.
So who, if you have that responsibility, maybe they should give you the reins and you can run the show.
Well, there are those of us who believe that the provider-led managed care is the way to go for long-term care and integrated health. So we're glad we may have a champion here for that.
Okay,
as we move along. For all of you, the food insecurity has become such a problem for a lot of folks who have been just disconnected from their pay, from their work, and from everything else. Can you all comment on some of the ways in which they can find some help for those families that are really having trouble, access, especially a lot of our folks with disabilities who are having trouble accessing nutritious food. So especially during the pandemic, and a lot of agencies, including ours, are helping out with that. But there's still so many people that are falling through the cracks with that. So we have a lot of not only family members, but care managers from the care coordination organizations here. We have representatives of the DOE and other people on the line here viewing this. So you just comment on some of the ways in which they can access better access to food security.
I know I talked about this before, that places like the district that I represent, where many of my neighborhoods were in crisis before the crisis. They were already pantries that were operating very close to capacity, if not over capacity. And obviously it's gotten worse as many people have lost their jobs. The little level of stability that they had, they've lost. So there's a couple of things. I know that there's grab and go meals that exist at different schools all across the city. There is a way you can actually text just the word NYC food, so NYC FOOD, or si habla español, comida. So you text that, the number, let me look for it for a second. It's 877-877. So if you text NYC food, one word, or comida to 877-877, you'll be able to at least get a sense of what localities are close to you for grab and go meals. And there's also different resources in every district. I mean, my office has been working along with churches, community centers, to kind of facilitate, like, because the resources are on a week-to-week basis. We can tell you like places that you need to go. There's pantries that operate every week, and most folks already know about those, but contacting your elected official's office would be a good way to do it, since there's resources that are particular to every neighborhood. And in certain neighborhoods, there have been community efforts that for mutual aid that have popped up, and sometimes we facilitate resources to those folks who are already members of the community and are doing some good work in identifying those in need. So I would say if you are in need, you can do those things. Look for resources that are there from the city. Reach out to your local elected official. And this is very important. if you are a person, and I certainly consider myself one of those folks who is privileged enough to be able to have a level of security, I have a place to sleep, I know I'm going to be able to have a meal today, then you need to do a little bit more. Not only demand from government, as we are doing, that government needs to do more so that we can provide for all most vulnerable, but we as individuals should also do our part when we can. If we have some privilege, then we should use it. You know, I took my, just as a quick example, so I was able to get the check from the federal money from the stimulus check, right, that they sent to everybody. So I qualified and I got it, but then I actually gave it to different folks that actually need it for more than me, like gave it to a pantry and gave it to that. There was this online effort to identify like gig workers that were, gigless during the height of the pandemic. So doing things like that. So because I didn't need it, I'm going to, I have a salary, I'm good. So things like that, finding things that you can do if you are privileged enough to kind of help somebody else out, like do it. So those are some of my suggestions.
Assemblymember Reyes or Senator Kavanaugh, do you want to weigh in on this as well?
No, I just say, first of all, I'm glad that Assemblymember Ray has identified this right at the top as a health issue. It is absolutely critical for people to maintain, good access to nutritious food. We've been pushing to make sure that a lot of the government's role is making sure that the funds necessary to acquire the food is available. And, we pushed very hard in the budget to maintain those funds. And, as Senator Rivera said, a lot of the ability to deliver food or provide food through pantries is localized. We have some terrific organizations working in Chinatown and the Lower East Side and in a lot of the neighborhoods in Brooklyn I represent. But you should be able to, during the pandemic in particular, get nutritious food delivered to your doorstep through an organization. Some of them are even very good at allowing you to choose what you would like to have delivered. So you should reach out. You should call 311 as a last resort as well and ask, or not as a last resort. You should call 311 and ask what resources are available where you live. But also, as Senator Rivera mentioned, your local elected officials should be able to plug. We've all been working very hard on this issue and should be able to plug you into local resources that can help meet your needs as well.
Yeah. I also wanted to say that, we've all been doing our own individual work in our respective districts. Also, the city has provided more funding for some of the existing pantries. So we've had pantries in the community that perhaps used to serve 100 folks, now serve double that based on some funding that they've gotten from the city. And that has been incredibly helpful. And also the community efforts that Senator Rivera mentioned. A lot of mutual aid has kind of developed organically within the community to ensure that everybody is really getting everything they need. And Gustavo gave his stimulus money. I was cooking for my building, for some of the seniors in my building, because I like to cook.
If I cooked for anybody, it would be harmful to them. So I did them a favor by getting it to somebody who knew what the hell they were doing. I'm a good eater, not a good cooker. I just want to state that for the record.
Assemblymember Reyes, you're a member of the Education Committee in the Assembly, and one of the, it seems to many people that the education system in New York, not that it's broken, but it's cumbersome. I mean, you have the Board of Regents, and then you have the State Education Department, the local districts, the local departments of education. And in our case, which governs both the public and non-public schools, in our case, at ADAPT, we have, in our preschools now, we have over 1,100 children throughout the city that we provide preschool services for. We are, in fact, the voluntary sector here, unlike some places throughout the state, as where they have BOCES and other publicly operated programs. I'm wondering just what the work of the committee is, because one of the things that we're constantly looking at just how tight that is for us, and we're trying to we have and people don't always understand the cost of preschool education, which is rising. And of course, the state right now, it's not a good time to talk about increased dollars, but cost of education is rising. But at the same time, we provide needed access for 3 and 4-year-olds, particularly for therapy through early intervention, which is more Senator Rivera's area. But but just to talk generally about the work of the committee relative to special education.
So I'm not a member of the education committee, but I'm very versed in this topic because I'm a mom.
Sorry.
But it's okay. So look, in terms of child care and early education, first there's been this huge coalition that has been pushing for reimbursement and kind of a restructuring of that. Because we've seen that many of these providers haven't gotten paid during this time. There's been a delay in payments. And that has, of course, been affecting how they deliver services to families. But more importantly, we've also seen that this hasn't necessarily been a priority for our state, ensuring that there is adequate child care and early education, early childhood development dollars for families that need it because it's either a single parent home or they have childcare issues and parents work. But I think it's important for families to know their rights, particularly, and know what services are there for them. And the state is required to provide free, appropriate public education for children, regardless of their disability, and to provide those accommodations as well. So increasing funding for education has been one of the biggest issues that we've been struggling as state legislators, and that's fully funding our schools and fully funding services for early childhood education. And that has been a push because the governor isn't always necessarily on the same page as us. And oftentimes he presents an idea that he's looking to fully fund our schools, but really fully funding our schools means that we have to redo or completely change our education funding formula. And that's something that the governor has not been willing to really address. And for us to have equitable funding throughout the state, we have to readdress our funding formula.
Thank you. For all of you, right now we're, like many industries, we're in a crisis mode. Since 1974, people with developmental disabilities have been funded well since the end of the Willowbrook era. And throughout all the administrations, both Republican and Democratic, as well as both in the Senate and the Assembly, there's been a concerted effort to ensure that individuals with developmental disabilities have both rights and access to housing, to training, to education, and all the privileges and that we all, as members of the community, have. This past year, there is obviously, the state of New York is in flux with its own budget, and there's no way around that. There's no light at the end of the tunnel unless there's going to be aid to the states. The governor has correctly, I think, indicated that there's a $15-16 billion budget gap, which you guys are going to have to help him address as time goes on here. We'll see what happens. But
I would challenge that a little bit, but go ahead with your question.
Well, it's significant. There's a significant budget gap in any event.
Without a doubt.
Right now, in our view, since the onset of the pandemic, we've closed day programs, and by and large, although some are opening up a little bit for members of, pardon me, and for a while, the state was giving us retainer payments to keep staff employed and to do things virtually, and most of that is dried up. And as of October, our biggest problem is that there are 35,000 folks with developmental disabilities living in group residences in the state of New York.
Mr. Matthews, I'm sorry to interrupt, but since I have to get off, I'm already 5 minutes late for my thing that I had to do at noon. I wanted to just address this really quickly. The challenge,
we need help.
the reason that I would challenge you a little bit is because I do not believe that the governor is correct. The governor is indeed talking about a significant budget deficit, and I don't doubt that we have that. But number one, the light at the end of the tunnel, we can have, you're right that we need and we must continue to demand federal assistance. And that is the light at the end of the tunnel. But guess what? There can be candles along the way, and those are called taxes for billionaires and millionaires. The revenue that we could get from the taxes that we must put on tax on billionaires and millionaires would actually give us added revenue to be able to better address those cuts that we're talking about, to be able to make sure that the cuts to different services across the spectrum on health, on social services, on education are lessened. And the governor insists that he doesn't want to do that. Further, there is a debate that we're having right now about money that we already got from the federal government and whether we could use some of this money to actually pay some of the contracts for services that have already been rendered. And the resistance to that, because we believe there's many of us in the state legislature, I believe that both of my colleagues signed on to the letter and kind of joined this effort. I don't want to speak with them, obviously, but we believe that there is a way in the definition of this particular funding to be able to use it to pay back some of these services which have already been rendered. So I would say, as a last word for me, we need to continue to push. You should certainly push your local elected officials, but you should put your efforts to focus on the governor, because the governor is not saying anything about taxing millionaires and billionaires. He's kind of dismissing the idea outright, while he is asking all of you to sacrifice further. And then on top of that, there is money that we already have from the federal government, which we could potentially use to pay for those services that have already been rendered. These are things that we must do, because if we don't, and you can actually fill in the blank on that, because you are the folks that provide the services and you already know how challenged you are in providing those services. So I just wanted to, just for me, that would be my last word.
Yeah, and right now, $238 million is being, as of October 1st, is being taken out of the system. Primarily by the governor's budget office and OPWDD, which will restrict more access of people living in group homes to access their community partners, to have people who have significant disabilities admitted to these residences because of cutbacks. And the fact of the matter remains is that we're being treated differently and worse than any other group. And so both Senator Carlucci and Assemblymember Gunther, who lead the committees, have been foursquare in their advocacy about that. So I'm asking all of you to join them and us in the advocacy to try to do something about this, because it's just unfair.
And you know, every year when we do the budget hearings, because I'm chair of alcoholism and drug abuse, I sit on the table, I guess that they call it, with mental health, and OPWDD is included in those discussions, and for the O agencies, as they call them. And every year I try to grill the commissioners and say, you know, we don't accept pat answers, you know, and we don't accept cuts. Of course, it's a battle. You know, I think there are various heroes in the legislature who take up the OPWDD and the other O agency battles. But we are constrained by what the governor's executive budget is, and it's handed to us, and we don't have really as much freedom as we would like to move funds around. That's why lobbying beforehand is also very important. But yeah, it's true. People with developmental disabilities and their families, and I know quite a few, they're worried about what's going to happen with their kids when they're gone. And they're worried that the people who take care of their families don't get paid a decent wage. So just when you have like a good rapport, sometimes the home worker leaves because, you know, they can get paid more. And unfortunately, sometimes they can get paid more, for example, in McDonald's than taking care of someone, because the pay scale is so low, and that is unconscionable. I mean, what are we here for? We're here in government to make sure that everyone in society is taken care of. And the amount of money given to this area is certainly paltry compared to the needs. So we just have to keep fighting every single year. And, you know, you guys are great at this with demonstrations and coming up to Albany and fighting, but it's really maybe, you know, I think what we are in the position we're in now, we have to tax multimillionaires and billionaires. And there's a host of bills for revenue raisers. But we've always seen things from the point of view of the haves. So we're afraid the people with money are going to leave the city. So we don't want that to happen. Why don't we think about the people who will stay, have stayed, and have needs? Why aren't we putting their priorities first? Because we know that people with money, and this has been surveyed in the past, don't mind giving more. As a matter of fact, some have urged us to tax them. But the fact is that even if they're not so happy about it, they won't really even notice it because they have so much money. And I think it's really only the decent thing to do. I mean, Washington is in chaos. Who knows what's going to happen if we're going to have another stimulus package? One day it is and one day it's not. And, you know, the nonprofits who provide life-saving services and necessary services can't be the ones to bear the brunt of this terrible economy. And so, you know, that's part of my marching orders to myself, that I go out there and fight for everyone who really can't sustain and absorb cuts when they've already been given so little in the first place.
I mean, the governor also has this arbitrary 2% cap, right? Which the numbers, the initial deficit was subjected to fit within his 2% cap, which is, I think, one of the reasons why Senator Rivera was saying that he may not necessarily agree with the numbers that are projected from the governor's office on where we were in terms of our deficit and how we can raise the money to pay for the services the state needs.
And maybe I'll jump in here just to say, so I agree, and I've been a strong proponent of for a long time in raising taxes in a progressive way that will cause people who have made a lot of money, including many people who have made a lot of money during the pandemic. If you were invested in certain ways, you've done very well in the last 6 months, the last 4 months as things have come back. There is a lot of money we can generate by taxing people, and we absolutely must do that. I just want to add, Gustavo started by saying that the light at the end of the tunnel is federal assistance as well. And I do want to emphasize that should not be assumed either. In your advocacy efforts, you should make a little time for advocating to your Congress members, to your U.S. senators, to the White House if you have a relationship with, if you're inclined to advocate in that way. But we need the federal government to do a stimulus bill. It has been many, many months now. They allowed the pandemic unemployment to expire on July 31st, which means many people who had been stabilized by that program lost that stability effective August 1st. We need that. We need those programs to include money to stabilize the services that states and localities are providing. That I'm very ambitious about taxing progressively. We're not going to generate all the money we need by taxes within New York State, just given how difficult the economy is. So we really do need the federal government to step up. They can spend in a deficit way. They can borrow and spend in a way that states can't, and they need to do that. And just one more particular plug. Part of that effort needs to be rent relief. We talked before about keeping the moratorium in place as long as necessary. And again, I am committed to the notion that nobody should get evicted because of COVID-19 and for however long it takes. But at some point, as Assemblymember Reyes mentioned, the rent bills will become due one way or the other. And the way to address it, there are different models of that. One is to cancel the rent and then compensate the landlords. I've been focusing more on a proposal to just pay the rent outright, pay tenants rent directly. But either way, it's going to take billions of dollars. I think the cancel rent bill is currently pushed by some of the tenant advocates, but actually costs substantially more. But in any case, it's going to take billions of dollars. And the federal government is well positioned to do that. We've been advocating for that kind of money since March. And it would be about $100 billion nationally, about $10 billion for New York would go a long way toward resolving that. That is a small amount relative to the trillions of dollars that the federal government has been giving out, a lot of it going to large businesses that don't necessarily even need it. So just don't assume the federal government. I think the federal government will act eventually, and I think we'll get that money, but don't assume that. Make that part of your advocacy strategy. But I agree, also advocate to the governor and to your assembly member and your senator to make sure that tax increases on wealthy people are included in the way we dig our way out of this.
You know, again, the governor we're asking the governor for his help here, not to attack him, but that, right, you know, that this is a very short-sighted decision with very long tentacles. I mean, now it'd be very difficult for a lot of agencies because of the way in which they're structured, to accept people with very challenging or medical needs, because they don't want to pay us anymore when someone's in the hospital, when someone goes home or does anything else. So these kinds of efforts, I think, are very short-sighted, and we just ask all of you to lend your voices to the chairs of the committee. As you said, there's not much you can do with the governor's budget, but you can lend your voices to what he needs to do.
Absolutely, and I hope, I'm sure many of my colleagues are happy to do the same.
Indeed. Well, thank all of you for your time and effort today, and for being not only friends to ADAPT and Community Network and its constituencies, but to all vulnerable citizens in the state of New York. And thank you for your advocacy. We thank you for your work in the legislature. And we will certainly, I'm going to turn this back to Kate. But again, I want to thank you for your time and effort today, and for all of us throughout the year. Kate?
I second that, and I also want to thank Edward Matthews for being our moderator for today's session, and also for all the viewers out there. If you have any questions that weren't covered in today's session, we would love for you to let us know. We have a survey that's available, and you can put your questions in there, and we'll reconnect with the elected officials, and we'll get you responses to those questions. And thank you so much for participating in the plenary session, and have a great rest of your day.
Thank you to everybody. Thank you to my colleagues, and thank you to ADAPT for doing this. It's been a great pleasure.
Thank you,
everyone.